Association of breast cancer and alcohol. Breast cancer is one of the most prevalent cancers affecting women worldwide. It affects 1 in 8 women in the United States over their lifetime. In 2020, there were an estimated 276,000 new cases of invasive breast cancer diagnosed in women in the United States. Alcohol consumption is common among both men and women, but the focus here is on women due to the subject matter. About 54% of women report consuming alcohol in the past month, according to CDC data. Studies consistently show a positive association between alcohol consumption and the risk of developing breast cancer. According to the American Cancer Society, women who consume 2 to 3 alcoholic drinks per day have about a 20% higher risk of breast cancer compared to non-drinkers. The risk of developing breast cancer increases proportionately with the amount of alcohol consumed. For each 10 grams of alcohol consumed daily, roughly equivalent to 1 drink, the relative risk of breast cancer increases by 7 to 12%. Alcohol increases levels of estrogen and other hormones associated with hormone receptor-positive breast cancer. It may also act as a solvent for other carcinogens or be a carcinogen itself. All types of alcohol, including wine, beer, and spirits, have been shown to contribute to breast cancer risk. Risk varies across different populations, but the increased risk due to alcohol consumption is generally consistent. In addition to initial diagnosis, alcohol consumption has been associated with a higher risk of breast cancer recurrence. Patients who consumed 3 to 4 alcoholic beverages per week had a 34% higher rate of recurrence compared to those who abstained, according to a study published in the Journal of Clinical Oncology. Guidelines such as those from the American Cancer Society recommend that women limit alcohol to no more than 1 drink per day to reduce the risk of breast cancer. Some guidelines go even further, recommending that women who have been diagnosed with breast cancer abstain from alcohol entirely to reduce the risk of recurrence. The scientific evidence strongly supports the notion that alcohol consumption increases the risk of breast cancer in women. Reducing alcohol consumption is a modifiable risk factor that can significantly lower breast cancer risk and potentially reduce the risk of recurrence. For those interested in delving deeper into this topic, comprehensive information can be found on the websites of the American Cancer Society, Centers for Disease Control and Prevention, and the World Health Organization. Many scientific journals also publish peer-reviewed articles that offer a more technical view on the subject.